If you're one of the 50 million Americans with allergies, it's not the end of the world. Luckily, there are some easy and effective ways to prevent and treat allergic reactions. Here's Dr. Paul to tell you how.
Since there's no cure for allergies, the easiest way to control them is to limit contact with an allergen. Let's talk about some realistic prevention tips. You may want to pause or rewind or take notes while we go through this list. If you have outdoor allergies, try and stay indoors, particularly on dry, windy days between 10 a.m. and 4 p.m. during seasons when pollen is at its worst. Also, try to avoid being outside at sunset when mold spores drop to the ground. You can also go online or listen to the radio for a daily report on pollen and mold measurements. Wear clothing that is loose and light, and wash them with hot water after each use. When you're indoors, avoid rooms that may be more prone to mold, like basements or saunas. Reduce moisture in your kitchen and bathroom by fixing any leaks. You can also try using dehumidifiers throughout the house and a high-efficiency particulate air or HEPA filter in your bedroom. Keep windows and doors closed during high pollen seasons and keep an air conditioner running. Keep your house clean. This means changing your bedding and vacuuming every week and not having carpeting, stuffed animals, or feather bedding in your bedroom. Think twice about getting a pet, or if you have one, bathe him every week, brush him often, and keep him in areas that aren't carpeted. Having a hypoallergenic pet, which means a pet that produces less dander, may also limit an allergic reaction. Finally, try to avoid smoke or perfumes and cosmetics that seem to make symptoms worse. Now, allergic reactions of some degree are just going to happen, even if you take every precaution. The good news is that there are a number of treatment options to manage your indoor and outdoor allergies. Let's talk about the most commonly used ones. First, there are antihistamines and decongestants. Antihistamines may help relieve sneezing, itching, runny nose, as well as rashes or hives. They are most effective if you use them on a regular basis throughout the allergy season, rather than waiting for symptoms to appear. Decongestants can reduce the stuffiness you feel in your nose and chest, but probably won't help you with itching or sneezing. Next, eye drops may help you with bloodshot, watery, or burning eyes. Corticosteroid creams and ointments can relieve rashes or itchiness on your skin, while corticosteroid nasal sprays can help reduce nasal congestion. If these don't work, leukotriene inhibitors may also be an option. Also, oral corticosteroids may help reduce swelling. There are pros and cons for each of these medications, and it may require some trial and error before you find the right treatment. Be sure to consult with your doctor to determine what's right for you. If medication alone doesn't solve your allergy problems, your doctor may recommend something called immunotherapy. This means receiving regular injections of an allergen over the course of 3 to 5 years to ultimately desensitize you. Since there's no cure for allergies, the best way to manage them is to simply get tested, pay attention to when they're worst, and to work with your doctor to find a treatment plan that helps you with your symptoms.
With the right prevention and treatment, allergies can become very manageable, so you can limit the impact they have on your daily life. Thanks for being a part of Healthy Nation. Be sure to watch other segments and get talking about your health.